Thank you, Madam President. I come to the floor. I know my colleague from Indiana, Senator Donnelly, is going to be down here to talk a little bit about his amendment, and I want to support him in that, along with the senator from Pennsylvania, Senator Casey, because we're here to say we need to stop this war on Medicaid. Throughout this health care process, it's very clear there are many on the other side of the aisle that just want to cut or gut Medicaid. What we're saying is, if you're serious about protecting Medicaid and stopping the war on Medicaid, then you should support the Donnelly, Cantwell, Casey amendment, which would recommit to the Finance Committee with instructions to strike or reduce or eliminate the language about Medicaid. It would prevent or discourage a state and make sure that they are not prohibited from expanding a Medicaid program, and it would say, don't cost shifts to the states. With this motion, we're saying to our Republican colleagues, we don't want to cut people off of Medicaid. We want the committee to do exactly what the Republican governors are saying, which is quit beating up on Medicaid and focus instead on fixing the individual market. The individual market is 7%. What we've found with the expansion of Medicaid that has been done by both Democrat and Republican governors is great success. I hope my Republican colleagues will heed the warnings of our nation's Republican governors and Democratic governors. In June, they sent a letter to Senate leaders from 7 bipartisan governors. The letter from places like Ohio, Montana, Nevada, Louisiana, Colorado, Massachusetts, and Pennsylvania shows the diversity both of our nation and political parties in saying, quote, we believe that first and foremost, Congress should focus on improving our nation's private health care insurance system, end quote. And then they say, quote, Medicaid provisions included in this bill that has been proposed by the House are particularly problematic. Instead, we recommend Congress address factors we can all agree on needing fixing, end quote. So the message was clear from these governors, including Republican governors, and I hope that my colleagues will listen to them. The nation governors know because they've had to provide and be a partner on Medicaid for their citizens. They know how it affects their economy, and they know what it does when families in their states get access to health care. They reduce the bankruptcy rate. They help people stay employed. It boosts GDP. All of these things have been the benefit of Medicaid expansion that we've seen in Washington state that cut the uncompensated care cost in half. It also resulted in the creation of new jobs, and a bipartisan study found that the current bill we're debating, the House bill, if passed, state economies would shrink by $93 billion. So pulling the rug out from under Medicaid recipients would hurt jobs and hurts economies in Nevada, Alaska, West Virginia. West Virginia would lose more than 10,000 jobs, more than $1 billion in gross state product, and more than $1.7 billion in business output. Nevada would lose 3,300 healthcare jobs, and Alaska would lose 2,600. So all of these things are ways for us to say, if you're serious now, before you go home for the August recess, about protecting Medicaid and stopping this ridiculous war on Medicaid, vote for our amendment. Stand up and say, you understand that we may have challenges in the individual market, but it doesn't mean that we should cut people off of access to health care through Medicaid. I thank the President, and I yield the floor.